Hello, my name is Suzanne Lentzsch. I'm an associate professor of medicine at Columbia University, New York Presbyterian Hospital, New York. I'm here at the ASH meeting to present the results of a study, lenalidomide and dexamethasone. Alone is equivalent to lenalidomide and dexamethasone with autologous stem cell transplant in newly diagnosed multiple myeloma. Interim study analysis of a randomized trial. We were interested in the role of transplant for newly diagnosed multiple myeloma patients in the light of the availability of novel drugs, very potent drugs like Velcade and lenalidomide. The study included newly diagnosed multiple myeloma patients over 18 years. Patients were included if they had a multiple myeloma and fit the CREB criteria. The study is a randomized prospective study that randomizes patients into the transplant and non-transplant arm. We present here data of the first 50 patients. It's an interim analysis. The accrual target of the study is 60 patients. The data we present here has a median follow-up of 3 years, and patients were treated either with lenalidomide dexamethasone for 8 cycles in the non-transplant arm, or for 4 cycles with lenalidomide and dexamethasone, followed by a transplant in the transplant arm. Both arms received a stem cell collection, and after completing the active study part of either 8 cycles lenalidomide and dexamethasone or 4 cycles followed by transplant, patients went onto a maintenance for 2 years with lenalidomide 10 or 15 milligrams only. In this trial, we didn't observe any unexpected toxicity. Lenalidomide is an approved drug, and the main side effects were neutropenia and also fatigue. The primary objective of this trial was to assess the response rate in the transplant arm versus the non-transplant arm. Secondary objective was the progression-free survival as well as the overall survival. With a median follow-up of almost 3 years, we evaluated the overall survival rate, the progression-free survival rate, as well as the response rate. In terms of the response rate, we saw an overall response rate including complete response, very good partial remission, and partial remission of 96% in the patients who were randomized to the lenalidomide dex arm plus transplant. Patients who received lenalidomide and dexamethasone only had an overall response rate of 77%. In terms of the progression-free survival and overall survival, there was no significant difference between the arms. The progression-free survival in the lenalidomide and transplant arm was 17 months. The progression-free survival in the lenalidomide and dexamethasone arm alone was 25.2 months. In terms of the overall survival, patients treated in the lenalidomide and transplant arm had an overall survival of 57.6 months, whereas patients in the lenalidomide arm only have not reached the median overall survival. Again, the median follow-up of those trials was 3 years. There was no significant difference between both arms in terms of progression-free survival and overall survival. As I mentioned already, this is an interim analysis, and the next plan is to complete the accrual to this trial. The number is 60 patients, and to extend the further follow-up and provide a next follow-up in around 1 year.